now, no specific cure is yet available for certain specific diseases, such as cancer. Furthermore, modern medicine has a certain degree of side effects when it comes to the treatment of certain diseases. This prompts people to try and to use TCM along with healthy food as a form of prevention. However, verifying TCM safety and efficacy is also an important factor on considering whether to use these alternative therapies or not. Chinese medicine is a multi-component complex system, and it's hard to screen its efficacy in cell models. At the same time, experimentation on animals such as mice, rats, pigs, dogs, etc. needs long feeding cycles, long times to set up animal models with the disease, and its cost is high. All of the above-mentioned factors make it difficult to carry out large-scale screening of TCM. This is why we selected zebrafish with hepatic cancer as the main reason for the screening of TCM in treating hepatic cancer. Zebrafish is native to the Himalayan region, India and Bengal. They have a genetic similarity with humans up to 87%, and they reach sexual maturity in a short period of time. Thus, variants can be generated by mechanical or chemical means for research purposes. Therefore, zebrafish have been widely used to study vertebrate embryonic development disease research, drug screening, and toxicology testing due to its photoperiod-induced spawning and its external fertilization, and also due to the fact that the number of eggs discharged at a time is high. Their embryonic development is quite fast. Furthermore, the eggs and the embryos are transparent. First, and this is the two main ways to administer drugs of zebrafish. And at present, the main disadvantage of direct immersion is the difficulty to measure drugs absorption rate. Also, it is not applicable to water-insoluble drugs, while intraperitoneal injection may injure the fish and is hard to put into practice. Not to mention the fact that there are restrictions on the amount of pharmaceutical usage. Therefore, this study aims at developing a new system platform for the oral administration of TCM in zebrafish to ultimately accelerate the TCM screening process in zebrafish animal models with particular diseases. And this is our research purpose. First, testing the optimal conditions for alginate micropellets coated with TCM and the palatability of zebrafish. Second, to develop a new system platform for the oral administration of TCM in zebrafish. As the picture you see, it is our experimental protocol. First, we prepare the tank alginate coated micropellets to understand under what conditions
没关系，你就直接讲，你讲得很顺啊。
we could obtain the roundest and smoothest dry blank alginate coated micropellets with the best formability. Next, we prepare alginate micropellets coated with different feeds and TCM to find out the palatability of medications in zebrafish. Then we determine the rates of encapsulation efficiency, expansion, and the release of alginate micropellets coated with TCM. We determine the rates of encapsulation of alginate micropellets coated with TCM to find out how much medicine is in the micropellets. then for the expansion, we can avoid zebrafish die after they eat the algae and macropellets coated with TCM. And we determine the rates of release of algae and macropellets coated with TCM to realize the release rates in the zebrafish.
This is the HPLC chromatogram of the TCM standard, ferulic acid. In figure A, we can see that after about 15 minutes, there's a peak. There's a peak after about 15 minutes. And on figure B, there's also a peak at the approximate time. By doing so, we can confirm whether the medicine is successfully coated in the micropellets. Table 1 shows the size of plant alginate micropellets after drying for different time and different concentrations of alginate and calcium chloride. We can find out that when the calcium chloride concentration is 2.5% and the alginate concentration 1.5% after drying for 24 hours, there's a best size for the micropellets, which is about 10 millimeters per 10 pellets. There are 4 pictures that shows alginate micropellets coated with different feeds under different calcium chloride concentrations. Table 2 shows the micropellets coated with different feeds and different calcium chloride concentrations. We can find out that no matter the calcium chloride concentration is 1.5 or 2.5%, the micropellets coated with brine shrimp eggs are relatively bigger, and the micropellets coated with general feed and brine shrimps has a palatability rate of 35% and 70%. And both sides are well. However, we also find out that the alginate micropellets coated with brine shrimps has a mortality rate of 40%. These are 2 pictures of alginate micropellets under water and intestinal fluid. Because of the reason of mortality rate, we decided to find out that it was caused by the expansion rate. Therefore, we find out that when the alginate concentration is 1% and the calcium chloride concentration 20%, coated with 0.5 gram of chanchong has a best encapsulation efficiency of about 60%. And that when the calcium chloride concentration is 20% and the alginate concentration 1%, coated with 0.5 of chanchong has a palatability rate of 60%, and the size is also well for the zebrafish. In conclusion, we decided to coat 1 gram of general feed and 0.5 of chanchong at an alginate concentration of 1% and a calcium chloride concentration of 10% to prepare the alginate micropellets coated with TCM. Under these conditions, the formation of alginate micropellets coated with TCM can form a proper particle size. Thank you for